Aphthous ulcers are the commonest oral ulcers. Benign oral ulceration is usually aphthous ulcers. These are caused usually because of an autoimmune reaction, though we are not very sure about the causation. Aphthous ulcers are small ulcers in the oral cavity, sometimes on the tongue, sometimes on the lips, sometimes on the cheek mucosa, and they cause intense pain. There is usually an area of redness around a white base. The ulcer causes pain in and around the ulcerated area. Treatment is usually symptomatic, just pain relief, some gargles, and if we have diagnosed this to be an aphthous ulcer, some steroid application can be made to make healing happen faster. Aphthous ulcers are of three types: minor, major, and herpetiform, but that diagnosis is usually made by a doctor when he or she will examine your throat to determine what is the nature of the problem. Sometimes vitamin supplements can also be given to help the ulcer heal faster. There are other more serious type of ulcers also, particularly in diseases related to pemphigus and sometimes the Stevens-Johnson syndrome, where systemic and oral steroids may also need to be given to make your ulcers heal and to prevent spread of the disease. Sometimes if you're in the habit of chewing pan or gutka, you can have a traumatic ulcer. Even a bad or an infected tooth or a sharp tooth can cause a traumatic ulcer, and these ulcers can be dangerous because they can turn malignant, and a malignant ulcer can sometimes be difficult to treat. So if you have a persistent ulcer in the oral cavity, you must have it checked out, and if necessary, a biopsy may need to be done to find out the exact cause and nature of the problem. Ulcers are usually treated symptomatically. There is no specific agent or medicine that can make them go away. They go away by natural healing over a period of time. Specific causes must be dealt with separately and must be treated on an urgent footing. During an ulcer, it is better to have cold fluids, to have sweeter things, because spicy food can cause problems and hot food can cause burning and pain at the ulcer site. So normally the kind of food we recommend for these kind of aphthous ulcers is to have soothing fluids and to have things like smoothies, banana, fruits, etc., so that you can maintain your hydration and nutrition till the ulcer heals and the pain goes away.